Listen, look, if you got some sharp pain traveling down your arm or your leg, we generally think it's a pinched nerve, but that's not always the case. So I get quite a number of patients who come to me saying, "Doctor, मेरा pinched nerve हो गया, इसको आप treat कर दीजिए." But once I examine, what I find out is that it's an irritated, sore, tense muscle that's causing the pain. It's a muscle knot. So a pinched nerve is basically when your nerve gets trapped between a bone or a swelling or a disc in most cases gets pinched by a disc. So you'll have symptoms all along this of tingling, numbness, and pressure, temperature changes. All of those changes that you have are because of a pinched nerve, as opposed to a muscle knot. A muscle knot is much more simpler because it's more localized. I'll show you here. यहाँ पर अगर आप दबाएंगे, the pain is only in this area. Maybe it will radiate a little bit, but it's not like sciatica. अगर simple तरीके से बताऊँ तो pinched nerve behaves much like you stepping on a garden hose. So the treatment options for muscle knots are quite simple. It ranges from stretching. In some cases, you'll have to undergo physiotherapy, dry needling, wherein they put in thin needles down the muscle and break those knots. You feel a pop. That's a signature sign that you are dealing with a muscle knot, which is also a diagnostic value. That set aside, not all muscle knots respond to physiotherapy. They are much more resistant and they are much more chronic. You have dull pain all along your body, and in such cases, you most likely are suffering with something called as myofascial pain syndrome. It is a much more complex problem that needs to be addressed in a different way. That's where a pain physician comes in. We identify those muscles which are actually causing the problems. Using an ultrasound scanner, we find out the different layers of muscles and insert a needle and then inject a local anesthetic and a pain-relieving medication that mitigates most of the pain. In cases of myofascial pain syndrome, we have seen some great results. Now you're done trying to do all the self-tests and you're still not very sure what you're dealing with. We do all of that for you, and then once we know what you're dealing with, we have the right treatment. Most of our treatments are done in daycare. We don't admit you. We give no general anesthesia. So it's just door-to-door time is generally restricted between 1 or 2 hours. That's the maximum. And then you can walk back home. So if you have any more questions, DM me or send me a text if you have my number. And I'll see you on the other side. Goodbye.